This gateway theory is just absolute bullshit. I mean, there is no nexus whatsoever in all these statistics that they're spitting out. 80% of the people that used heroin smoked marijuana. Well, 100% of them made Ovaltine. There's no causation. There's no causal nexus. If anything, if there's a gateway drug out there, it's alcohol, and alcohol is legal because 100% of them have used alcohol. But I have people who come to me, they're in trouble. They've been caught with a small amount of marijuana, and they have no record, and they're obviously interested in getting the arrest removed from their record, and, completely, ServPro. It didn't happen. And oftentimes I'm able to do that, but it usually requires me to get them in some sort of a diversion program where there's going to be drug testing. And a lot of them at this point discover that they're really patients. They're really not recreational users. They are somebody that would be taking Valium or Xanax or something else, but for cannabis. They've been self-medicating for years and never even realized that's what they were doing. They just knew it made them feel better. And when we take that away from them, and of course there are going to be people that hear me say this and go, oh, well, there's an addiction there. No, but when we take this away from them, it places them in a terrible hardship because now they're feeling bad about life. And so I thought this was America. I thought if people could find a way to make themselves feel better and it's not hurting anybody else, they ought to be able to do so.